Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Cortisone injections. We've talked about the cortisone and how it actually can degrade the joint or the tissue that it's being injected. Today, we're going to talk about some recent studies that show evidence where you should be reconsidering that cortisone injection and looking for alternative options. This is going to be some important information. You're going to want to stay tuned. Okay, Dr. Mike, we've talked about cortisone injections for the last couple of years and educating patients on why they should consider alternative options when it comes to cortisone. There's been some recent research and the studies have started to come out that actually show why cortisone is actually can be detrimental to the soft tissue of the joint that you're injecting. So this is important information for our patients.
Sure, and I mean, there's always a debate. There's always an element of, is it effective? Is it problematic? Does it cause problems? But recent study just coming out just a couple weeks ago from a radiology conference. So a group of radiologists were looking at the understanding of injecting the joint. It was particularly a knee joint.
Okay.
And a prospective study looking at folks 2 years out. So they looked at people who didn't have injections, who had arthritis in their knees. They looked at a group that had the cortisone injections and followed them with MRI studies for 2 years and compared those to people who had a hyaluronic acid injection. People often call a gel shot.
Yep.
So that gel shot, again, is not inflammatory. It's supposed to reduce inflammation, and it's one of many things that could be injected, but it was really to compare if there's problems from the arthritis progression over the 2 years. And interesting, as the radiologists analyzed the MRI studies over a 2-year period, they showed that the idea that the person who had the knee injected with cortisone had a progression of their arthritis over those 2 years, but yet the group that did not have any injection and the group that had hyaluronic acid injection did not show progression of the arthritis that was compared to the group that had the cortisone. Now, there's a lot of ways to interpret that data potentially, but it really suggests that it was probably the fact that they got cortisone is why that knee joint had more arthritic changes in the years coming. And I think what really is interesting to me is it really looked over 2 years.
Yeah.
Because many times the short-term studies say, no, there's no really effect, really is not a problem, the cortisone can be very helpful. And that's true for a certain small group of people, or if it's just trying to hold you over before you may have surgery, but realities are to extend the life of the joint.
Yeah.
When you look at it length of time, getting cortisone now might have problems of the joint destruction in the sense of arthritis or degradation years later.
Right.
And that's what we're trying to prevent. So we need to do something for people when we are looking at them to try to preserve their longevity of their joint. Not just to cure that inflammation now, not just to make your knee feel better now, or a couple weeks, couple months from now. Really, we want to prevent needs of surgery or something that's much later. And that's why we have the services to think about, we don't want to do that cortisone, we want to give them other options.
Yeah, and those other options are really exciting. We're talking about regenerative options, or Dr. Mike often calls reparative options. So the two regenerative injections that we do in our practice are called a Wharton's-Gelic allograft. So that's from donor umbilical cord. That's completely safe. We've done a lot of those injections over the last 6 years. And one of the benefits is that this is a cellular injection, and naturally it's going to contain that hyaluronic acid that oftentimes orthopedists give to patients synthetically. So it's kind of bundled all in one. Those injections really work well in having restoration of some of the defect. And Regenerative Labs is the laboratory that we use out of Pensacola, Florida. They've done a lot of double-blinded studies. Certainly the research that they're doing with Montana State, particularly the electron microscopic study where they actually show the soft tissue defect, and then they do comparison, weeks, months later, where, after the injection itself, we can see that cross bridging and actually helping to repair those soft tissue defects. We know in our clinic too, the other option that we have, and oftentimes we use in combination 30 days later, is what's called the PRP injection. And that's a procedure where my lovely sister-in-law, Stephanie, comes in. She's our nurse. She does a blood draw with the patient. We get that blood, we spin it in the centrifuge. It separates the components. We're looking to concentrate those platelets because those are very rich in growth factor. And the thought process is for some of our older patients, we always talk about, as you get older, the number of regenerative cells that you're producing decreases dramatically. So particularly at the age of 50, that boost of the PRP really helps that Wharton's jelly allograft, last for a longer period of time. And, statistically, boy, we've been doing great. We've injected 1,102 patients so far. Only 54 patients haven't responded. And we've only repeated the injections 42 times. So most of our patients are still doing well anywhere from 1 to 6 years post-injection, including me, I'm living proof. And that's really exciting. If you think about options, like I always am surprised every time I do a consult after you see the patient and we look at the history, docs out there are still giving patients cortisone injections. And because you were in the field, there's really not much of an explanation as to what they're doing. They're usually coming in with that syringe loaded, ready to go, and they're not spending the time to talk to the patients about what their options are. And as a patient, wouldn't you want to consider, an injection that helps repair damaged tissue, then, increases tissue damage? It seems like a no-brainer, right?
It certainly does, but to the doctor's defense, sometimes if you're not trained in something, or if you don't offer those services, they go to what they know.
Right.
So I was trained in the same way. I only learned regenerative injections later on in my career. So if a doctor doesn't know what that service is to offer, or they don't offer it in their clinic, they're going to grab the cortisone and go there. It's how we trained, is way it's gone for many, many years. But what's nice about the concept and the science, we're at a crossroads. We're having more and more data suggesting that cortisone really is not helpful for the long term. Doesn't mean that it was wrong or necessarily, taught inappropriately, but we're learning that it's not the right choice for any longer. And we're getting more and more data science to suggest, hey, these reparative injections are really the way to go. And there's more science coming out about the way it's working microscopically, way it's working biochemically, and how it's going to potentially help preserve our body's joints and our soft tissue defects in the longer term. So we're in that transition. So doctors need to catch up, and patients need to actually be educated to say there are other options and you have the choice. And we're, again, of course, trying to choose the better for them in the long term, and we are trying to incorporate that to keep them more healthy.
Yeah, and Regenerative Labs, we tip our hats off to you. You've done the work on the research side. I was just talking to the CEO. They just completed their 70,000th data set collection, and we're part of that research protocol too, which is really exciting. And if you're a patient looking for alternative options and looking for options that are going to help repair damage to the joint, you're definitely going to want to give us a call. If you'd like more information about our practice here in Leominster, you can easily go to our website at maragalmedical.com. Folks, we have a wealth of information. We have a YouTube channel. Spent about 2 years just doing patient education videos. That's a great resource as well. We're a full-service physical medicine clinic where we utilize medical care, physical therapy, and chiropractic treatment under one roof. We have a special interest in the field of regenerative medicine. And best yet, we take most insurances. So that's it for today. I hope you'll learn something. We'll see you again soon.
Take care now.